In this episode of ACT Podcast, we're joined by Professor Oliver Groene, Chief Scientific Officer at OptiMedis and a leading voice in the Global Health Promoting Hospitals platform. In your recent visit to Kosovo in June 2025, you worked closely with hospitals and primary care centers in Peja, Jakova, Lipjan, and Pristina to support the integration of health promotion, patient-centeredness, and safety into their institutional practice. What does it mean to rethink healthcare from just treatment to driving well-being for individuals, communities, and health systems?
Well, first, thanks for having me. And it's a great question to start because hospitals and healthcare broadly are changing. They're evolving over time. And sometimes we need to help healthcare service to evolve a bit faster and adapt to the patterns of disease, patterns of epidemiology, also expectations of patients and citizens, and of course, the broader context in which we live, financial sustainability, and other factors. So, to some extent, hospitals perhaps haven't adjusted sufficiently to these trends that I just outlined, and were still stuck in a paradigm of treating diseases, treating patients that enter the hospital doors and then are subject to the decisions of doctors and nurses. But this paradigm doesn't hold anymore. Patients are now have different expectations. They have different diseases that require an active participation. If we think about chronic diseases, diabetes or other diseases like that, they require more than a medical intervention. They require patients to be treated, but also to be empowered and supported in taking a more active role. And that's the point of looking at well-being. How can we address this aspect of well-being and helping doctors and nurses empower their patients so that they are not just treated for the disease, but actually supported in a way to work towards their own well-being.
So, what exactly is a health-promoting hospital? How does it shift the traditional understanding of what hospitals do?
Health promoting hospitals started many years ago. In fact, it was initiated as a project after the first global document on health promotion was agreed or consented, the Ottawa Charter for Health Promotion in 1986, almost 40 years ago. And as part of the Ottawa Charter, there were 5 action areas for health promotion. And one was about reorienting healthcare from the traditional medically dominated paradigm that I just described to a more holistic paradigm of active involvement. And this is what health promoting hospitals stand for. It's a very complex model, a vision. It's more than just focusing on one aspect of quality or one aspect of clinical medicine. It's actually a very broad vision, helping hospitals taking a role in health promotion, which was often disregarded in the past, with hospital staff saying, well, that's the responsibility of public health or primary care. But health promoting hospitals assume a role, a responsibility in health promotion. And that is related not just to taking care of patients, but also taking care of their own staff, because hospitals are large employers with often thousands of staff. And unfortunately, often the resource staff has been neglected in the past. Harsh working conditions, shift work, and emotionally charged work sometimes. So health promoting hospitals also look at the health of staff, taking a more active role in promoting staff health. And finally, they're looking at the community, because hospitals as buildings are located in a community. And again, what we've seen in the past, sometimes there was a mismatch between what the hospital does and what the community needs. And if the hospital is only doing fancy stuff, but the community has very basic needs, there is a mismatch. So health promoting hospitals that look at this more broadly, patients, staff, and the community, not just at disease, but also at the factors that contribute to health, and more broadly at the determinants of health.
What made you get into the field of health promoting hospitals? Is there a personal story, a personal interest?
Well, there's an anecdote, because as a student, my first degree was in medical sociology, and I was studying at the University of Bielefeld who at that time built the first school of public health in Germany. And the dean of the first school of public health, very untypically, was a sociologist. Usually they're doctors, right? So it was a sociologist. And it was a sociologist who was actually very well familiar friends with Ilona Kickbusch, who at that time was leading the division of health promotion at the World Health Organization in Geneva. And as it happened, I passed through the corridors at a long day after studying, and I saw a leaflet offering an internship at WHO. And I had just read about the Ottawa Charter, and I thought, wow, this would be interesting to learn from the source what is done in health promotion. So I did an internship in Geneva, 1997, and then I did another internship at WHO in Copenhagen the following year. And during that year in Copenhagen, I was introduced to the Health Promoting Hospital Network. And to some degree, I never let go. And I kept involved in this network. So there's a personal history to that.
How does the concept of health promoting hospitals align with today's global health challenges?
Well, I said it's an old concept in a way, originated from the Ottawa Charter 40 years ago, but it couldn't be more current, couldn't be more up to date. Because at the time it was invented, it was perhaps more visionary, ahead of time. And now we are really in a situation where healthcare systems have changed and have to change significantly. And it's still the question how hospitals can be integrated into the whole patient care pathway. How can we help healthcare workers be more health promoting for their own good? And I think one of the key drivers that we have acknowledged in the past couple of years was COVID. Because COVID affected everyone in society, but in particular healthcare workers. And I'm not sure how it is in Kosovo. In Germany, post-COVID, it has been extremely difficult to attract workers to work in hospitals because of the experience that nurses and doctors had during COVID. So we have a real problem in keeping people in the hospital, retention of staff, but also attracting young doctors, young nurses into hospitals. So it's a concept that couldn't be more relevant than it is today.
You mentioned that one of the core pillars of the HPH model is the empowerment of patients and healthcare staff as well. How does this look like in practice?
Well, for patients, a very practical example is, you've got a patient who is smoking, who shouldn't be smoking. And of course, doctors will always say, yeah, I'm addressing that already. I told the patients not to smoke. Well, is that effective? Of course, it's not. So what hospitals have to do is they have to establish conditions, procedures, and train staff to really help patients stop smoking beyond the advice. Because everyone knows smoking isn't good for your health, right? But it requires a program, it requires motivational counseling, perhaps it requires group sessions, perhaps it requires sessions that involve family members, and perhaps it requires also a medical component such as nicotine replacement therapy. All of that is a complex part of the treatment, if you wish, but it's typically neglected because the primary condition or reason for admission was diabetic foot disease, and then you address the foot disease, but not the underlying factor that contributes to it, such as smoking. So that would be a practical example of a health promoting hospital having procedures in place to make sure that for every patient who smokes, the risk factor is documented, there's a program to follow up, the patient is educated, the information is passed on to the GP, and there's an acceptance that perhaps a health promotion intervention can also fail the first time, particularly if we're talking about smoking. Smoking cessation programs are highly effective, but typically require various rounds. So anyone who wants to give up smoking should also be empowered to say, look, it's good if you try, but don't give up if it doesn't work the first time. Try again. But this all needs to be embedded in the process, right? And it's not the single advice of the doctors, do more sports and stop smoking.
What evidence is there that embedding health promotion in hospital settings leads to better outcomes for patients, for staff, and for systems.
Yeah, there's a huge evidence base for health promotion interventions. And at the same time, there's a huge gap in implementing these interventions and adapting them in clinical practice. One area is called prehabilitation. So that means that the patient, before admitted to the hospital, is actually prepared for the intervention, prepared for the surgery. If you take the example of a patient undergoing an elective procedure, and typically there's a couple of days at least or weeks before the decision to admit the patient and the patient actually being admitted, how is this time usually used? It's not used productively. And that's a problem. It's a missed opportunity because this time could be used, say if there are 2 weeks between the decision to admit and the operation, to help the patient reduce smoking or engage in other health promoting behavior. And you ask about the evidence. There's strong evidence that, for example, stopping smoking before surgery, even 1 day before the surgery, has an immediate impact on the wound healing, on complication rates. So it can be measured in hard outcomes that are very relevant to clinical medicine and hospital management. So I looked up the studies in the Cochrane library earlier today because I know you would ask the question. So you can reach reduction in complication rates of about 10%. And that's very important, particularly for those patients who would usually have a complication, right? Because a complication would require perhaps a readmission, and that is costly. The other point is it reduces length of stay. On average, it can reduce the length of stay in a hospital about a day or 2 after a complex surgery. So that's very convenient for patients to go home faster, recovering faster. And depending on the way hospitals are organized and paid, it might be also very interesting for the hospital. In hospitals that are paid for procedures, diagnosed with related groups, there's a huge incentive to discharge early because you get the same money and you have a higher throughput. So in such systems, discharging patients a day earlier is also financially very interesting. And where hospitals might not have that financial interest, but where there's a lack of capacity in the system, it frees capacity in the system. So there are lots of win-wins in health promotion.
You spent almost a week in Pristina on this mission in June 2025, and you spent time with health workers from the primary and secondary care. What specific opportunities and challenges did you observe, especially if you compare them with other countries or other contexts?
Yeah, one topic that we discussed in particular is around patient experience. 2 hospitals that we've worked with in Peja and Jakova implemented the first survey of patient experience. And patient experience surveys are interviews, measures, surveys to ask specific questions about aspects of hospital care, such as was the communication, or how was the communication with the doctor? Were they polite? Did they explain in a way that you could understand? Were the hospital rooms clean? Were you explained how to take the medication when you were discharged? So these are very important questions that are addressed through patient experience survey. And we presented the results of the first survey in these 2 hospitals. And I think it's a great achievement to start on this journey, to collect this data and to learn from the data. Perhaps what we've seen as an opportunity from this study is that there's room for improvement on better explaining medications, better preparing patients for discharge, better activating patients to take a more active role in their disease management, in self-management. So there's this opportunity. And perhaps a challenge that I see and that we also discussed is if you think about the actions that are needed to educate patients, how do you actually do that? Where do you do that? Who does that? What kind of material do you have available? And we looked at the kind of spaces that could be used, reception areas that were newly built, information leaflets that were produced. So again, opportunities and challenges always go together. There are these opportunities now. The challenge is now for the hospitals to establish a work plan to put this into practice.
Kosovo is a very new member of the international network of health-promoting hospitals through the General Hospital in Peja, the General Hospital in Jakova, and very recently through the main family medicine centers in Jakova, Peja, and Lipjan. What does it take for a hospital or for a primary care center to become member of this network? How can they actively contribute to it, and what are the benefits?
There are formal requirements, and then there is the question how you make the best out of this membership. For example, if you allow me to use this comparison, you can register with a gym, and that's usually very easy, sign and pay, but then going to the gym is the difficult part, right? So it's the same with the health promoting hospital network. Our formal requirements are very simple. We need a letter of intent from the general director of the hospital, and hospitals pay a small fee depending on the level of the country. It's a maximum of 330 euros, and it's less for countries that are at a lower level of income. So it's a neglectable amount of money for a hospital, given the amount of money hospitals spend on other things. The benefit then is you're part of a community. We have 600 members in over 30 countries. There's an opportunity to learn from what other hospitals are doing. We organize international conferences. The next one will be in Sweden in May 2026. And there's also documentation that we develop, standards, self-assessment tools. We organize webinars, an opportunity to engage in working groups and task forces. So it really depends on the willingness of those that are responsible in the hospital to take this forward, to engage with the larger community. And if there's a willingness to learn and to invest a bit of time, then there's a great opportunity to actually take that knowledge from other countries and implement it in Kosovo institutions.
What are some first realistic steps that Kosovo hospitals and primary care centers can take to begin implementing the HPH standards?
Yeah, so we have a set of standards for health promotion in hospitals and healthcare services. There are 5 overarching standards that look at the management responsibility. They look at patient information, engagement, and activation. They look at staff health promotion, and they look at continuity and cooperation, meaning the embeddingness of the hospital in the wider community. And there are, if I'm not mistaken, 68 different measurable elements. So addressing all at once is too difficult, and you need to prioritize. I would suggest that hospitals that have undergone a self-assessment and have established an assessment on where they stand to identify priorities internally, perhaps an area where they're performing at the moment rather low, or where there's a perceived need to invest, or where there's an opportunity to align with another project or governmental policy. So these are criteria to develop priorities that could be addressed. And I would, in general, recommend not addressing more than 3 or 5 priorities or areas of health promotion at the same time out of the 68. But concretely speaking, I think the first step would be to follow up on the issues that I mentioned earlier, the patient experience survey, because it's the starting point of everything. Hospitals and healthcare services have an important role in staff health and community, as I said, but foremost, they are for patients. And let's start there and looking at the way we can identify patients with chronic disease that have particular need or benefit from health promotion. Let's learn from the patient experience survey and identify what it tells us in terms of improvement opportunities. Let's continue with the information leaflets that were developed and the new areas, reception areas and education areas that were established in the 2 hospitals to really educate their patients. But also, let's work closely with the primary care centers because they have a lot of experience in health promotion, and getting the staff and primary care professionals working together, exchange information on why patients with conditions such as diabetes are continually readmitted to the hospital. What can we really do to prevent that? these would be the areas where I would start with. And in addition to that, work on staff health, start identifying what are the key priorities of staff health. It might be nutrition, it might be physical activity, it might be mental health if there are issues of stress or burnout. So these would be my first areas or best guesses to start with.
When talking about health education, health promotion, and patient engagement, is the physical environment of a hospital important? If yes, how so? How does it matter?
There are people that you could invite for an own session to discuss this topic, because there's a group of people that looks at healthy hospital design and the role of architecture. But from the perspective of the health promoting hospitals, we have an own working group that looks at that, and that looks at light, the role of light, the role of sound or noise, the role of smells and sensation. When you enter a hospital, there's typically a sensation that you get which is not the nicest one. It's not the disinfectants that are used are very, very toxic and they have a strong smell. So light, sound, and smells have an impact on patient recovery. There was actually a paper published in the journal Nature, one of the leading journals in science, some years ago, that looked at patients' recovery, comparing patients that either had a room with a view or a room without a view. And patients that were looking at the park had a faster recovery than those that looked at the parking lot. So that's quite interesting to think what is happening with the patients and their emotions and stress sensors throughout the body that really helps healing and recovery. If you enter a hospital, you typically don't see a lot of that. You have these corridors, long corridors, and unpleasant lightning. So this could be addressed perhaps. But I see also great opportunities, because the hospitals that we've seen and Peja and Jakova have nice open spaces, green spaces, and parks that you could use. And I would encourage to see how we can use these open environments to help people take a walk once they are stable. They don't have to sit in the room until discharge. If they are able to walk, let them walk outside. It's a great space also to meet family members. And it's also a great space for staff members to take a walk and relax after a busy day or during a break to get some fresh air.
What about patient safety? How can it be embedded in the health promoting hospitals model?
Without patient safety, there can't be a health promoting hospital. Patient safety is a very important field that somehow is distinct from the health promoting hospitals, but at the same time, it needs to be integrated. If you think about that, on average in Europe, 10% of patients admitted to a hospital experience some sort of harm or adverse event. It's really important to address patient safety and make sure that these events don't happen, because we can talk about environment and architecture and light and gardening, but if the patient has a complication or an adverse event, this is not helpful. So we need to bring these concepts together. Again, the advantage is that the health promoting hospital is such a broad vision, comprehensive. It's not just focusing on one single area or clinical domain. It really offers the opportunity to embrace this topic of patient safety into the health promoting hospital vision and work together with all stakeholders, staff in particular, to ensure that patient safety recommendations are implemented.
What distinguishes hospitals that truly live up to the values of a health promoting hospital?
Well, one way to answer that question would be to say we have these standards with 68 measurements, and you've got the rating scales, and those that have the highest rating would be the ones that correspond to your question. But I think this would be the wrong answer. I think the right answer is to see how the ambition of learning and improvement could be documented. And hospitals have different starting points. You have hospitals with a budget that is, let's say, €1 billion in university hospitals in Germany. And you've got smaller regional hospitals with a much more modest budget. You can't compare these two. And also the starting point for improvement is very different. So I think the answer is more looking at the ambition of a hospital, looking at the dedication of hospital staff to actually implement the evidence that I've mentioned, and then looking at a way to integrate these ideas into every process of the hospital. Some years ago, I worked or reported on a study that looked at a typology of health-promoting hospital organizations. And that is a useful way to answer your question. So health-promoting hospitals are not running a project. They have to integrate the ideas of health promotion into everything they're doing. And some of the best examples of that I've seen in Taiwan. Some years ago, when I traveled to Taiwan, and the Taiwanese are our largest network in the health-promoting hospitals community, they have taken at the national level a very strong position to use this model of health promoting as a developmental model for hospitals. And I've seen hospitals that have really integrated the ideas of health promotion into everything they're doing, even on the palliative care ward, where you think, oh, that's a sad place and, you've got little time left. They are trying to make the best out of every minute that you are in this palliative care ward. They are not looking at a sick and dying patient. They're looking at a person that has days or weeks or months to live and making this time meaningful. So that's a very great approach to look at health promotion as a vision to improve well-being. That was also one of your starting questions of well-being. And I think it's really a great distinction to draw a line between diagnosis and disease on the one hand, and there we are with medicine and probably a paternalistic model, towards a model where well-being is the guiding point and where we take a person at every time at their life, and it might be close to death actually, but there's still a component of well-being and enjoyment and of sharing with their loved ones, and perhaps having the dog in the palliative care ward because it gives joy. At that time, perhaps the infection is less relevant. The joy is more important.
So what would be one piece of advice that you would offer to hospital managers or healthcare professionals in Kosovo who want to be champions of the health-promoting hospitals approach?
Yeah, it's a challenging question, because reducing everything I've said to one piece of advice is difficult. Also because the health-promoting hospital notion is very large in itself. But perhaps the advice I would give after having talked with the hospital staff, managers, nurses and doctors here in Kosovo is to look at culture. I think this is where Kosovo can really develop a lot, maturing in the culture of health promotion, and not assuming this is an activity, but really working together in a team to share, to learn together. If things go wrong, to avoid any kind of blame or shame. This is not conducive to learning, but really embrace this as an opportunity to learn from past mistakes or from the improvement potential that we have, and also to look at the broader community in the network, at other countries in the region that have had the same questions, that have the same challenges, and to learn from those that perhaps are a few years ahead in their development, and just ask questions and learn.
Thank you, Professor Groene, for sharing your insights on how hospitals can evolve from places of treatment only to catalysts of individual and community well-being. We hope your visit this week will continue to inspire meaningful transformation as Kosovo deepens its engagement with the health-promoting hospitals platform. Until next time, thank you for listening to the ACT podcast.